There's a multitude of things that people can do to prevent hair loss. The best is to start as early as possible in the hair loss journey. So we always have this motto that it's easier to salvage hair that you already have than to give yourself hair that you don't have. For that reason, we have a plan in place that involves medical treatment, stem cell treatment such as platelet rich plasma, and also low-level light therapy and nutritional supplementation. Who's a good candidate for hair loss prevention procedures? And the answer is anyone from a very, very early age. We see men and women as early as their teen years, extending throughout their entire lives to combat hair loss. People generally don't have hair that appears visibly thin until they lose 30 to 50% of the hair in a given area. So people could have completely thick hair and they have to lose hair for quite a long time before it becomes visibly thinner. Procedures in our office that provide for hair loss prevention, including platelet-rich plasma, exosomes, A-cell, those kinds of procedures are simple office visits. The duration of the appointment is usually anywhere from an hour to an hour and a half. We usually recommend that people have regular PRP treatments, and they could be spaced out usually as far as 6 months to a year apart, but it really is on an individualized basis, and we have to take a look at everything and make sure we come up with a proper and individualized plan for you. Every patient that comes to us, we evaluate for possible candidacy for DHT blockers such as finasteride or dutasteride. We also recommend potentially oral minoxidil. In addition to pharmacotherapy, we also recommend low-level light therapy. Specifically, we offer the laser cap here. In addition to that, we also recommend some sort of nutritional supplementation. It's so gratifying when patients come back, most commonly at about 6 months after their initial treatment, and patients report that, hey, my hairdresser says that my hair is thicker. My friends say, wow, your hair looks good. Like, I don't know, what have you been doing? They carry themselves a little higher. They don't have to feel insecure about their hair. And they just overall just feel better about themselves. And it just makes me so happy to see that. The one thing that I would recommend to people when it comes to hair loss prevention is early intervention. So if it's something that's starting to bother you or you're seeing signs of hair loss, come on in. Let's take a look. Let's see what we can do. There's a lot of options that we can do before the hair loss gets to something that's more serious. So prevention is really the key for any hair loss plan.